Yeah, I'm Peter Marsland, and I had problems with a broken heel 4 years ago now, and things developed. It became a serious infection, and I went into a hospital as an emergency patient. I was referred to a general consultant, but when he saw the problem, he said I needed to get in an orthopaedic consultant, and it was Mr. Attar who was the gentleman concerned.
Well, I'm Christine Marsland, and I needed a hip replacement 18 months later after Peter. So obviously Mr. Attar was so good, he was the one to do it. I was lucky, he was a hip and a knee man, so it was him obviously.
He'd seen this infection coming from the plate. He said, I know that's coming from the plate, and I feel it's going to come out. Now, a lot of consultants would have whipped it out there and then, but Mr. Attar, no, he did some investigations,
Yeah, he did.
very thorough investigations, which confirmed that the plate had to come out.
Well, for me, my hip was quite bad, and I should have had it done probably a year ago, but I couldn't because of Peter. I had to wait until Peter got himself sorted out. We couldn't both not be able to walk around, so it had got into a very bad state, and it did stop me from doing quite a lot of things. I can sleep at night now. I couldn't sleep before, the pain was so bad, and I'm better, aren't I? Yeah.
Oh yeah, 100% better.
He's very, very thorough, and his diagnosis are good. He doesn't act until he's got the full story. I found that with my hip, and he's very, very good at explaining things to you in terms that you can understand, but enough medical that you know you can sort of pick up what's going on quite well, and I like to know what's going on, so that was good.
And he always has time for you. You know, you never feel that, oh well, better hurry up, there'll be another patient around the corner. You always feel that he's letting you have the maximum amount of time that's needed. The good thing about Mr. Attar was that he discussed the operation beforehand. On the ward, he would come up to the room, tell you exactly what he was going to do, what the sort of pain you would expect and how he would overcome this pain for you, how long you would be in the theatre, how long it would take, and generally, you know, what he was going to do about it. The overall care that we've both received from Mr. Attar and his secretary Eve has been exemplary, really. Eve obviously has been the contact for the daily inquiries and so on and so forth, making appointments for us.
Yeah.
She's been really good, hasn't she?
Yes, yeah, very good. Yeah, it's just gone very smoothly. No,
they're a good team, really a good team, the two of them, and we know that if we can't get hold of Mr. Attar, we can get hold of Eve.